Folks, this is Dr. Graham again here at the Daily Dentist. Today we're going to talk about some important things dealing with hygiene, keeping the teeth clean. Last time we talked about brushing techniques. This time we're going to talk about flossing and how to keep the teeth, how to clean the teeth in between. Many people feel brushing is the main important thing, which they're correct. It is. It cleans most of the tooth surfaces, but cleaning in between the teeth, that's another thing that's going to keep your mouth clean and keep you from getting cavities or decay in between the teeth where it's hard for the toothbrush bristle to reach. There's a couple of ways you can clean in between the teeth. One is the traditional way with floss. And these days they have many different types of floss apparatuses you can use, okay? We're going to start off with the traditional way, just a regular floss here. And this here is a nice floss we got, ultra clean. It's pretty stretchy. It gets really in between the teeth if you have what we call tight contacts, and it does not shred. But this really helps us get in between the teeth and clean. And a lot of times people think you just want to put the floss in between the teeth and pull up. I'm going to start, hopefully you can see here. I'm going to start in the back here on the bottom. But you want to push the floss down between the tooth, and you want to kind of circle it around the tooth, kind of like a C shape and shoe shine, and push real good down between the gums, and then come up and go around the next tooth, wrap it around, kind of shoe shine like that, and come up and come out. And you want to do that again. Go down, in between, shoe shine, C shape rather, around the tooth, kind of shoe shine back and forth, come up, go around the next tooth, shoe shine back and forth, come up. And if you see how I'm holding the floss, you want to get it, if you're on the bottom, between your two pointer fingers there. And if you're in the bottom of your mouth, then you'll use your thumb to guide it down. Thumbs to guide it, pointer fingers to hold it, thumbs to guide it down. You push in, like I said, wrap it around like a C shape, back and forth, shoe shine, come up a little bit. Another tooth, back and forth, shoe shine, come on out. And you should put enough pressure. It's going to make your gums feel a little sore or tender initially. But once you do it enough, at least continuous for 2 weeks, your gums will toughen up and you will help that, get rid of that tenderness. And you won't see any more bleeding after you do it for a good period of time. A lot of times people think bleeding is normal. But I always tell patients, if I meet somebody and I shake their hand and my hand starts bleeding, they'll look at me like, what's going on? If I say, oh, that's normal, it does that all the time, they will look at me like I was crazy. So the same thing with your mouth. When it's bleeding, it's kind of like your check engine light coming on, telling you need to do something to get some treatment there, okay? But this is another pic from the Daily Dentist showing you how to clean in between your teeth with floss. The next one we'll show you is how to use another apparatus called a water pick or water flosser. Thank you so much, and we look forward to seeing you next time on the Daily Dentist.